You mentioned, Dr. Chavez, you mentioned in another video when we talked about toothbrushing and stuff that people cannot get away the stains and the stains on the teeth. They get away that yellowish film, which is the, what was that again?
There's plaque and there's calculus.
The black. They basically get away the black and to a certain degree. So no stains. That's where I guess teeth whitening, bleaching comes in.
Yes.
And from what I know, and it may be wrong, there are 3 major different ways of doing it. Over the counter, lots of stuff available. Going to a dentist and get those trays, take them home and bleach them. And then there is not super new but relatively new, fast way of with some machine, with some light, where it gets very fast. Can you tell us about the advantages and the disadvantages of all 3 of them? And if there's another one I missed, please.
Sure. Let's first address the over-the-counter materials. There's a plethora of them, and they keep growing. Every week there's a new material coming out. They have varying degrees of efficaciousness. Now, by and large, and I hate generalizations, but by and large, they tend to have less of active ingredient, so they're less efficacious. They'll take longer, and many times, because they're not customized to you, like you don't have specific trays, they're more like maybe strips where there'll be gel over the gums, over the teeth, you have a slightly increased chance of having sensitivity or issues. And so that, of course, is not my favorite approach. Your dentist can provide you with 2 basic approaches.
And this approach, which you just mentioned,
yes,
would probably not work for if next week my daughter gets married and I want to have white teeth, right?
Yes, they tend to be less effective. So
it takes longer.
It takes longer and greater chances of you having irritation of either the gums or even the teeth becoming a little bit more sensitive. And you're out of control. You're not under supervision and control of a dentist. The products that the dentist will provide for you are the following: customized bleaching trays. In other words, they'll take impressions of your mouth and they'll actually design trays that'll fit you perfectly, and will prevent
like a mouth guard, like a sports mouth guard. I mean,
yes,
something which fits over and closes and is in your mouth.
Yes, correct. Usually they're clear and they've been scalloped so that the edges do not overlap your gum, because we don't want the gel to overlap your gum. And because they are customized to you, the amount of gel that you place is very little. So you don't have gel running down your throat, or you don't get to swallow as much of the stuff. It doesn't get to lay over your gums as much. So it's much more precise and it's much more effective. And usually the material, of course, is much more powerful than anything you could get over the counter. So if you're looking for reliable, consistent, least amount of hassle, least amount of side effects, and most efficacious, hands down, go to professional, and you'll get a professional device. The other option is something along the lines of Zoom. Now, there's many different variations of lights that are used. Zoom is probably the dominant one in the industry, and basically you'll come in for about an hour and 15 minutes, and with Zoom we'll take you to the fence. We'll take you very close to the maximum whitening that you are able to experience for your teeth.
All in that hour of like the 15 minutes kind of?
Yes, in an hour and 15 minutes, usually that's the timeline. We'll apply a gel on your teeth, and then we use this very bright light that its nanometers activated specifically for the gel activating solution, and will turbocharge the bleaching of your teeth, and that usually is very efficacious. Now you can line up 10 people and go through the same procedure, and you have 10 different shades of teeth. How white your teeth become really depends on the type of enamel that you have.
Yeah, I'm sure it is. So what about, I assume, because it happens with almost all other health matters, people didn't get yellow teeth just for nothing. They did things which made it yellow. And I assume that it is very difficult for them to stop things which make their teeth yellow. So they will keep smoking, they will keep drinking red wine, they will have coffee, whatever it might be, which created. Is there other things which people should pay attention?
Anything with chroma, anything that has a lot of color in it, beets,
You know, Coca-Cola sodas.
Sure.
So most likely, you know, if people don't stop doing that stuff for other health matters, they won't do it for teeth. So
Correct.
as this comes back again, it may have taken 10 years for them to get their first bleaching, or 20 or 30 or 50 for that much. But it will come back. They saw it can be nice. What about that, chaps? How is that handled? You know, how, you know, can a person, you know, you can only have so many bypasses, you know, 2 or 3 of them maybe, and after that the doctor will tell you, that's it, you can't cut anymore.
Well,
what about this?
Well, if you have the home bleaching trays, then you can, every 3 months, every 4 months, as you feel that your teeth are becoming darker, you can go ahead and independent of your dentist, whiten your teeth. Because you have the trays at home, you have the gel at home, so you're set.
And the whole, I assume, the whole, this coloring stuff isn't so engraved yet, so 1 or 2 nights might do the trick again, right?
Exactly. And the beauty of the home trays is that you can titrate. So it's really up to the patient to decide how white they want their teeth to get.
And can that be combined with a guy who does the zooming, so he gets it white in an hour, but then 5 months later he wants it again? Does he now have to come for that hour again, or can he do one of those trays?
You can undergo the zooming probably, you know, every other month if you'd like. Though I think that'll be totally overkill. You'd have to be doing a lot of cigars and a lot of red wine to require that. Usually when somebody undergoes, for instance, the treatment of Zoom, it'll be about 7 to 8 months to a year before they actually feel the need to do it again. I prefer them, if they're going to do the Zoom and then also do the bleaching, the home bleaching trays, because then they can maintain that and obviate the need to go through the Zoom again.
Great. Now, let's go back to the over-the-counter thing. I have heard that one of the small things you might want to pay attention to, and might want to go to a dentist before, even though you have decided on over-the-counter stuff, which is okay, that you might want to check whether you have fillings and stuff like that in it, which you might not be aware of it anymore due to a long time ago, because they might not, your tooth might get white and your filling stays yellow, and then all of a sudden you have that yellow light coming out. Is that true, actually?
Yes, if you perchance had a crown or veneer in your front tooth and you whiten your teeth, well, that porcelain is not going to change color. Your natural teeth will go whiter, and then you'll have one dark yellow tooth up front. So you got to be mindful of that. And especially if you're going to do any cosmetics, you should really speak to your dentist about, should I whiten my teeth now and then match my cosmetics to that new color? Okay. So if you have, for instance, a composite filling, one of these white fillings, and you whiten your teeth, that's not such a big deal. You can go back to your dentist, and your dentist can maybe remove that filling. Sometimes it just needs to buff it.
But you will see it coming out. You will see that, oops, there's something there.
Yes, if you have if your original dentist matched a filling to yellow teeth, and now you whiten your teeth, you're going to have a yellow filling in the middle of white teeth. So it needs to be addressed.
Got it. It can be, however, then fixed. But maybe you want to fix it before. You want to look at it before and get at least that little advice.
Yes.
Do it after a tooth cleaning. Go for your normal tooth cleanings. Oh, by the way, I'm thinking of bleaching. Anything in there which I might have a surprise coming up.
Yeah, it always helps to talk about things before you do them.
Wonderful. Lots of options.
Yes.
Thank you.
You're welcome.